Here at Community Health Charities, we represent health-related nonprofits. National charities that you're very familiar with and some local ones that you might not be, but all that represent very important work, programs and services that are all health-related.
In October of 2007, we lost our 10-month-old daughter, Sophia, to SIDS. And shortly after, we had a pastor at our church tell us about an organization called Face Lodge. And he thought it might be helpful for Chris and I to go and spend a weekend at the lodge.
It was at the right time for us when we found it, and it really helped us springboard into dealing with our grief.
It helps to be around people who have gone through something like you have.
I was diagnosed with ovarian cancer in May of 2012, and it has a very high mortality rate. It is a terrible disease that affects mothers, daughters, sisters, aunts, grandmas. And because of MOCA, we're here and we're together and we support each other.
17 months ago, my daughter was born with a very rare and catastrophic form of epilepsy, leaving her having hundreds upon hundreds of seizures a day. It was never something that we would have imagined would be a part of our life, but it has brought us to where we are now.
This is Stephanie, my daughter, and she was diagnosed with epilepsy when she was a senior in high school. She had suffered a seizure in her sleep. This is a condition called SUDEP, sudden unexpected death from epilepsy, and she didn't wake up. And when you're faced by a situation like that, you want to find some good. You want to do some good. You want to make some sense out of it. And for me, that was the Epilepsy Foundation of Minnesota.
Shortly after we moved up here, I started realizing that it was difficult for me to remember the names of streets and locations and places that we had visited. We talked to our doctor and started doing some testing and some more testing, and started really coming to the realization that I was not remembering things very well.
In 2005, I had my first acute manic episode. I sent out a manifesto, a 25-page manifesto to 150 contacts of my email. And they realized that I had pretty much lost connection with reality. The organization I'm representing today is the National Alliance on Mental Illness.
I'm here because my son Cole was diagnosed with acute lymphoblastic leukemia when he was 2.5 years old. And the charity that I'm here in support of today is the Leukemia and Lymphoma Society. Giving to community health charities is really easy. You have the option of giving to us, Community Health Charities, and we'll distribute your donation evenly among all of our member charities, or you can write in 1 or 2 charities that are close to your heart.
By giving money, you're helping to continue the work that they do, helping families cope with this diagnosis.
And I've been able to meet so many different people at the walks, raising money, who care so much about this, and I don't think that any kid should have to live with this disease.
It's just a few dollars, but it makes a huge impact, and it's easy on me, but it's easy also on the charities.
Every single dollar raised goes towards finding a cure and providing access to patients.
Know that your dollars are being spent wisely and carefully.
It makes me feel good. I've done something, and we know exactly how much of that money goes to each part of these programs.
A lot of the research that they're doing now is making huge gains in treatments and medication and being more consistent across the country.
And that's why charity giving is so important. This is how we enrich our communities.
I invite you to participate and to donate to NAMI or any of the organizations that are part of this wonderful coalition of the Community Health Charities of Minnesota. Gracias.
On behalf of all the charities that we represent, thank you.